I'm Danielle. I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment on you. Can you please tell me your name and date of birth?
Angela Panazzoli, July 16, 95.
I'm going to wash my hands. I'm going to take a look at your wristband here. Okay. I'm just going to draw the curtain for some price. Okay. So the temperature is appropriate and the lighting is appropriate for you to perform this head-to-toe exam. I have 4 words I'm going to have you tell me throughout the exam. It is banana, blue, hot dog, and car.
Banana, blue, hot dog, and car.
So now I'm going to assess your vitals, your blood pressure, your pulse, your temperature, and your respiration. Those are all within normal limits. I have obtained your height and your weight, and your BMI is good. So now I'm going to move on to the exam. First, do a general survey. Your level of consciousness is appropriate. Your stated age is appropriate. Sexual development is good. Your level of consciousness already. Your nutritional status is appropriate. Your hygiene looks clean. You're dressed appropriately for the weather. Your mobility is smooth and even. Your speech is clearly understandable, and you have no limitation for range of motion. So I'm going to start my actual head-to-toe exam. I'm going to start with your head. It is normal cephalic. There are no lumps, bumps, or concave areas. I'm going to feel your temporal artery. It is smooth and moderate. I'm checking your TMJ. I'm going to have you open and close your mouth. There's a little bit of a click, but that is okay. I'm going to feel your sinuses, if there's any pain or pressure in your maxillary and frontal sinuses. Nope. Okay. So now I'm going to move on to your facial expression. Could you please smile for me? Frown and close your eyes. That is cranial nerve number 7. So now I'm going to take a look at your eyes. Your eyebrows, eyelashes, eyelids, and eyeballs are all symmetrically even, bilaterally. I'm going to now check your pupil restriction and dilation. I'm going to shine a light onto each side. If you could just stare ahead for me. Both eyes dilated and constricted equally and reactive to the light. Now I'm going to test your accommodation. If you could follow my pen light to your nose. Both eyes curved inwards appropriately together. I'm going to check your 6 cardinal positions of gaze. This is testing your cranial nerves 3, 4, and 6. You could just follow my pen light with your eyes only, keeping your head still. Alright, and then I'm also going to have you stare ahead again and look at your corneal light reflex. The light shine in the same position in both eyes equally. Now I'm going to have you pull down your bottom eyelids here. Your conjunctiva is pink. Your sclera is white and glossy. You can let go. Your corneas are not cloudy and they are clear. So now I'm going to take a look at your ears. I don't see any deformities, any bumps, or lesions. I'm going to palpate the auricle and the tragus. Do you have any pain when I do that?
I did the one that I...
So now I'm going to move on to your nose. It is center midline to your face. It is appropriate size. I'm just going to palpate. There are no deformities. To check on the inside for any deviation. I don't see any deviation. The turbinates, middle and inferior are visible. It is moist, pink, and smooth on the inside. I'm going to test the patency of your nostrils. If you can close one wing for me and breathe in and out. All right, and do it on the other side. All right, I don't know any obstructions. Now I'm going to do the smell test as cranial nerve number 1. If you close one of your nostrils, you can tell me what you smell. Alcohol smell? Yep, and I'm going to have you do the same on the other side. Alcohol smell. All right, perfect. Going to move on to your mouth. Your lips are not cracked, they're pink, and they are equal in the center of your face. I'm going to have you open up your mouth, take a look inside. You stick your tongue out for me. This is testing cranial nerve number 12. That is to check if there's any tremors. There are not any. And have you open again and say ah. Your uvula rose midline, that is cranial nerve number 10. Your tonsils are grading of 1+. Your mucosa is smooth, pink, and moist. If you smile for me, right, your teeth are white and aligned. No disease, missing, or broken teeth, and your gums are pink with tight margins. And then I'm going to test your gag reflex, which is cranial nerve number 9. Your head open. Okay. Gag reflex is intact. I'm now going to move on to your neck. I'm going to feel first. I don't see any protrusions. Your trachea is midline and center. Your head is erect. I'm also going to take a listen to your carotid artery. I'm going to have you take a breath in. And on your exhale, I'm going to have you hold your breath for me. Okay. All right. So I'm just going to listen in 3 areas: at the end of the jaw, mid-clavicular, and the base of the neck. I don't hear any bruit. So I'm going to have you follow some range of motion for me. I'm going to have you put your head up, down, side, side, and then touch your ear to your shoulder without moving your shoulder. All right, your range of motion is full movement, maybe strong against resistance. That is cranial nerve number 11 with equal muscle strength. Now I'm going to move to the back. I'm going to note that the ribs are sloping downward. The spiny processes are center and midline. There are no protrusions. Now I'm going to test the expansion. At T9 and T10, I'm going to have you take a deep breath in for me. The expansion is equal bilaterally, and I'm going to listen to the 9 pairs of breath sounds for 1 full respiratory cycle. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 8, 9, 7, 8, 9. I'm going to come around to the front again. And I'm going to have you repeat those 4 words that I gave to you earlier.
Hot dog.
Yeah. Yeah. Got 2.
Oh my goodness, I can't remember. I can't remember. Something you drive. Car.
Yep.
No, that's like
3 out of 4 is good.
Perfect.
All right. So we're going to move on to your chest. I'm going to listen to the 5 pairs of breath sounds in your chest.
The first thing you use is just pelvic.
1, 2, 2, 3, 3, 4, 4, 5, 5. They're equal and clear bilaterally. I'm going to take a look at your upper extremities. They are warm, smooth, and pink. No edema noted. I'm going to have you squeeze my hands. Your muscle strength is equal bilaterally. To check your capillary refill here. Less than 3 seconds on both sides. Now I'm going to be checking your breast for any lag, dimpling, or retraction with 3 maneuvers. Maybe you put your arms up. Put them down on your hips and push in. And then push in here. There's no lag, dimpling, or retraction, so there's no need to further do an examination. So now I'm going to have you lay down flat for me and turn your head to the left. I'm going to be looking at your jugular vein, and when I raise you up to 45 degrees, it should flatten. Okay, I no longer see your jugular vein. Now going to lay you back down to about 30 degrees. I'm going to check your chest for any heave or lift. I don't note any. I'm going to palpate your apical pulse. I don't feel it. And then I'm going to auscultate for 1 full minute to note the rate and rhythm. Okay, it is normal rate and rhythm. Now I'm going to lay you flat. Wait, no, I'm going to do your heart sounds first in the Z pattern. The first note with the bell. 1, 2, 3, 4, 5. And the diaphragm, and then the fingers with the bell. No murmurs were noted, so no further exam is indicated. I'm going to lay you flat and look at your abdomen. So now I'm going to listen to your vascular sounds with my diaphragm in 4 areas starting in the right lower quadrant. 2, 3, 4. Vowel sounds were heard from 5 to 30. Next I'm going to listen to your vascular sounds with my bell at 7 points.
Is 70?
1, 2, 3, 4, 5, 6, and 7. This is a non-surgical belly, so I'm going to lightly palpate in all 4 quadrants. If it was a surgical belly, I would only ask if they were passing gas. I'm going to start in the right lower. Do you feel any pain or tenderness? All right, the demeanor is calm and there is no guarding. Now I'm going to ask you, do you have any painful urination, lesions, rashes, itching? No. All right, so there's no need to further exam the peri area. Now I'm going to move on to the lower extremities. They are warm, there's no edema, the skin and hair distribution is even bilaterally. Going to check the pulses at the popliteal, the posterior tibial, and the dorsalis pedis. They are 2+ in every area. Going to check the plantar flexion. I'm going to do the Babinski up on both. There was no flaring of the toes, so she is a negative plantar flexion. And maybe you pull up towards you, push against me. Muscle strength is equal on both sides. You have a plus or a minus less than 3 seconds for the capillary refill. And then I'm going to have you sit on the edge of the bed again. Let me just lower it down here for you. Alright, for this I'm going to have you close your eyes. This is the neural part of your exam. Me touching 5 different areas on your body. If you could just tell me where you feel that sensation. Okay. Face. Yep. Arm. Hand. Leg. Foot. Yep. Wonderful. So I'm going to have you keep your eyes closed and you're going to give me your hand here. I'm going to put a position. You can tell me what finger is up. Index finger? Correct. I'm going to have your hand open. I'm going to test your sterignosis. And I'm going to have you tell me what is in your hand. And like, yep. And then keep your hand open with your eyes closed. I'm going to draw a number or letter. If you could tell me what it is. 1. Yep, that is your graphesthesia. You can open your eyes. I'm now going to have you put your arms out. And you're going to touch your nose with your finger at rapid movements back and forth. All right, the movement is smooth and coordinated. Now I'm going to check your lower extremities. I'm going to have you do your heel to your shin on both feet, just like that. All right, the movement was smooth and coordinated. There were no tremors. And then I'm going to have you do a rapid movement. Put your palms down on your legs. You're going to flip them back and forth at a fast rate. Right, she's able to do that bilaterally on both hands equally, smooth and coordinated. Next, if they had MS or any other kind of ataxia issues, I would not be doing this next one after I do the deep tendon reflex of the knee jerk. Perfect. So I do not have to do any other deep tendon reflexes, but if I were, I would be doing Achilles, brachioradialis, bicep, and tricep. I'm going to now have you stand up, please. Close your eyes. All right. I'm going to sit back down. There was no swaying or unbalanced issues, and that was testing her cerebellar ataxia. Do you have any questions or anything you would like me to do before I leave? No. Okay, I'm going to wash my hands and I'm going to go document. And you're going to tell me those 4 words.
Banana, dog, blue.
Yep.
Wonderful. Got him.
Thank you.
You're welcome.